Well, good morning. This is Lucinda Nord with Indiana Association of United Ways, and Roger Frick, our president and CEO, has joined us to offer this mini webinar on our Kindergarten Readiness Project mini grants that we will be offering this year and next. So let's just begin. Again, if you have questions, don't hesitate to put them into the chat box. So just as a reminder, many of our United Ways have been engaged in early education activities because they see a need in their community. They really want to help children prepare for school. They see a real need that kids are arriving to kindergarten behind their peers or without exposure to some sort of early education or pre-K. So we have worked on both program solutions and policy solutions. So I just don't want to miss out on the opportunity to tell you that we're in the middle of this legislative session already and actively advocating on the policy front for increasing quality childcare and expanding pre-K options. And one of the great program solutions that many of you are working on around the state is this concept of a kindergarten countdown camp or a kindergarten readiness camp. And we want to talk today about the Kindergarten Readiness Project mini grants that we will be offering as funded by the Lilly Endowment. To give a little bit of background, I know we did a webinar last week about the Kindergarten Countdown Camp, and you can find the detail, but for the purposes of today, I just want to go over a couple highlights about the Kindergarten Countdown. We sometimes abbreviate it as KCD, about that camp background. So it started actually with United Way of Central Indiana, where they were really looking at the fact they looked at their local data. They saw that kids were not arriving to kindergarten on time. There wasn't a great awareness about kindergarten readiness, and children weren't actually showing up on the first day. So they actually had a three-pronged approach to address those three needs that they identified with local data in their community. They had been running those kindergarten countdown camps for a couple years, and then IU Health approached us at IaUW to consider expanding those to counties also served in the IU Health system. So you can see over the last 4 years or the last 3 years, we have expanded those to multiple counties, lots of camps throughout the state, and we know a number of other United Ways are actually supporting local efforts as well, whether it be like the Cass County Begindergarten program. But you can see the map at the right illustrates the IU Health camps, those service areas in red, and then some of the inspired camps where camps in Knox and Wells County were actually using some of the same materials, the program model, and the same metrics. The camp design is very intentional, and it is a 4-week, sometimes 6-week camp, half days at least, in a school. It's really important that the camp not be in a summer program or in a recreational program, that it's really intended to be an introduction to kindergarten with the structure of a school setting. The camp includes a qualified teacher and often an assistant, so again, to replicate that kindergarten experience. Excuse me for including the IU Health volunteers each day, but for the programs that we've been running, we've had volunteers in the camps each day, again, to provide that additional support. Our camp design that we've been using in this system the last several years has included a sort of approved curriculum, and for many of the camps they used the Cozy Corner curriculum. In other communities there might be a school-based curriculum that's driven by the school. But what's really important for our purposes is that we wanted a consistent metric that could be used in all of the camps, and we've been using the Get Ready to Read pre-literacy assessment from Pearson. Admittedly, it's not the greatest kind of assessment tool. There are lots of other assessment tools that provide deeper and richer data, but this is a quick assessment tool that provides pretty consistent results and findings, and can be administered by volunteers and untrained, uncredentialed staff. There are a couple of variations about the camps that we've been running across the state. Typically they're offered during summer school, but not all camps provide transportation. Some do, some don't. Some have identified that the school won't provide the transportation. So for example, in Bedford, Lori really worked with the city to provide a city bus. In some of the communities, the school provides the meal as a part of its summer school program, and in other communities, a local organization or even the hospital provides nutritious meals. In many communities, they use this as a way of getting the children ready, and because they're low-income children, actually providing backpacks and supplies. Some of our camps, like the camps up in LaPorte or in Bloomington, include field trips to other local organizations. Many of the camps have included parental engagement activities, and Lafayette had some great examples of parent engagement. And then, as I mentioned, we've had a number of great examples in United Ways that weren't affiliated with the IU Health Project, like the Begindergarten program in Cass County. We know in Allen County they've been looking at some different projects, so we know that there are others. There's a school-based program in, I believe, Madison County, so we know that there are other models, but for our purposes, we're talking about a fairly consistent model that we'd like to see in this Kindergarten Readiness Project grant opportunity. So from last year, we actually, using those Get Ready to Read scores, we were actually able to look at the pre and the post tests and observe growth and really start to compare across. Again, not to look at how one school compares to another, because it might be based on what's the makeup of the incoming students in that particular school, but really looking at what kind of growth are those students seeing and what are the outcomes. So we're not only looking at the test scores, but also starting to look at how much are we helping increase awareness in the community about the importance of kindergarten readiness. How are we increasing the partnerships, for example, with corporate partners or community partners, or in the case with the hospital with IU Health. And then there's the other aspects of school readiness that we know are so important. For example, thinking about the fact that many of these children have not had any kind of structured environment, so they may not know how to stand in a line or eat at a table or put their items in a cubby, you know, how to have the kind of structure that they have in a camp setting. There are a number of other elements that we talked about in the Kindergarten Countdown Camp webinar, and I won't go into detail there on this webinar. But just to give you a couple of highlights from that, we wanted to remind you what that camp model looked like. And again, some of the partners that you might bring to the table can offer other contributions. So in the case of the IU Health example, not only did they provide funding through IaUW to support those camps, but they provided a lot of other in-kind kind of contributions, including providing volunteers. And admittedly, it wasn't consistent all the way throughout the state, but there was a strong volunteer component. They do call this their signature volunteer program. Many of the hospitals ran book drives. They provided backpacks. They filled those backpacks with information for parents and for students. In some of the communities, they actually did all the photocopying for the camp. And in a couple communities, they actually provided the nutritious meals for the students during the entire camp. So there are lots of examples that you can look at partners in your community to help reduce the actual costs of a camp. There are great examples in Lafayette of the partners that were developed there. For example, Lafayette had specific congregations adopt specific schools to provide volunteers in each day. Or in Bedford, Lori was successful in getting a particular grant to provide the city bus to be able to provide that transportation. So we have lots of great examples of ways to bring the costs of a camp down and to invite new partners to the table who can get excited about your new effort. So what you all want to know is, what about this money that was included in the Lilly Endowment proposal for 2014 and 2015? And that's really the purpose of this particular webinar, and that's why Roger is on the line with us, so that he can help share how he presented this to Lilly Endowment and the kinds of questions that they had. So let's move on. So the basics about the grant is that we're looking at this model really adopting the community impact model, that you're looking at a need and trying to move the needle in your community on this particular issue of kindergarten readiness. We know that it's not a lot of money. We only have $200,000 for both years, not $200,000 each, $200,000 for both years. So what we wrote into the Lilly Endowment proposal that was awarded is a maximum of $15,000 per United Way, that there is a local match requirement, and that match requirement increases in the second year. And this concept that we really want this to be a defined project, that whatever your kindergarten readiness project is, whether you do a camp or something else, it has to have a clear sort of beginning, middle, and end, and a common metric that's used by another United Way. So what was so inviting about the Kindergarten Countdown Camp model is that we had programs all over the state being operated in different settings by different groups, using the same model and the same way to capture how students are improving their readiness in the pre-literacy area. So that's something that we really would like to see in the mini grants that are available through this project. So this is the overview of the criteria of the for the kindergarten readiness project. So it has to address a community need, really looking at who's at risk in your community. Do you have local kindergarten readiness assessment results available from your school system, for example? The target population is 4- and 5-year-olds. We might be able to talk about 3-year-olds. If you can provide us some rationale for that, we can talk about that, but really looking at targeting the 4- and 5-year-olds. The project should have a common program design, so you could use the sort of this kit of Kindergarten Countdown Camp. You don't have to call it Kindergarten Countdown. You can call it whatever you want. But it has to have those same program elements with the same common metric used. So if you use the camp model, we would like you to use the Get Ready to Read assessment. You can certainly use other assessment tools as well. We know that a number of our United Ways, either through their schools or through their United Way efforts, are using other assessment tools as a part of their camps, but we do want you to use the Kindergarten Ready or the Get Ready to Read assessment so that we can have a common metric for all funded projects. We want you to identify the timing of your program. So most of the programs can be conducted in the summer if you run a camp, but there might be another project that somebody can dream up that could be operated during the school year. There will be a match requirement and some sort of evidence of collaboration in your community. I know that we had the question at the Executive Roundtable in December that this particular grant has sort of 2 levels of collaboration. One is in your community, so how your local United Way or United Fund collaborates with your school system or other partners, and the other is the collaboration among United Ways. So the collaboration among United Ways is really in this common metric that we're using, or the common program design. It doesn't require you to engage in a formal relationship or agreement with another United Way. It's more around the common design and the common metric. And then lastly, that you're not replacing other funds. So that's the criteria. And now we'll go through and actually answer questions and talk a little bit about the specific program model and metric. So we talked about how whatever your project is, it has to have a clear beginning, middle, and end, and a measurable outcome. So quite honestly, the camp model is easiest probably and most likely to be funded because it's familiar, it has all of those components. It has a common metric tool of that Get Ready to Read assessment. But we are willing to entertain other types of program models. So for example, if you have in your mind a specific parental engagement model or some sort of program that would improve your early care, where you have a metric that you could use, or an early reading program. What this funding is going to do is fund a project, though. It's not going to fund your planning or thinking or hiring a consultant to develop something. This is really going to fund the work to get something done. It does require collaboration and timing. Again, we talked about talking with your school or your school district. So if you do not already have that relationship with your school or your school district, that is probably one of the first calls you want to have to explore, what's already being done in the community and how this partnership might grow. You might want to think about other partners. You might think about the timing of the grants. We're looking at, and we'll talk about the actual timing, but we'll award the first round of grants in late spring for implementation this summer, and then depending upon what other ideas we hear from you, we might have sort of a second round or a summer round for the following school year. And then the IaUW Grants Committee is going to review sort of the packages that we put together. They won't necessarily review all the details of every project, but just like when we're working with IU Health on the kindergarten countdown camps, we put together a sort of package of we're going to fund this many United Ways to support this many camps. We expect a similar kind of package that we would run before the Grants Committee for the Kindergarten Readiness Project, that here's the number of projects, here are the number of United Ways, and the types of projects they're going to do. The match requirement, and this is where I'm going to turn it over to Roger to jump in here and talk a little bit about anything we've discussed so far or the match.
Okay. We proposed this in the model of our collaborative grants. That's why you have the 25% match. Our collaborative efforts of multiple United Ways have always required that element of match, and so we want to do that here. As a collaborative, this is completely prescriptive, which is a little different for us, but it's an opportunity for all of us to learn a little bit about participating in a program that's prescriptive, where we've kind of defined, here's what this money is for, here's what you can do with it. We want to see kids in classrooms as a part of this program. The match funds need to come from either your United Way or a local sponsor. Match that is associated with the kindergarten readiness cannot come from any other grant funds from IaUW, nor are any sponsorship or funds you draw to this program eligible for matching in your general Work Together grant. So essentially we're saying the dollars you draw to this or the dollars you choose to put in have to be purely local dollars, purely identified with the readiness program, and not categorize anything else connected with granting. In year two, clearly we are going to ask you for more match if you look for funding for 2 years. Part of that is the usual grantor's desire that we don't just create something that you have a dependency. Our history with Kindergarten Countdown says the programs have merit. All the reports from people are that teachers and schools absolutely love it. We've had a number of the Kindergarten Countdown folks report on how great teacher support for United Way has been as a result of engagement with Kindergarten Countdown. And so it is a great investment in the relationship, but it's a great opportunity. We're trying to provide a resource to let you get started on this that we believe is easily sustainable. And so that's why the match requirement increases, and clearly beyond year two we have no notion of whether this might continue or be expanded. We're going to learn from year 1 and 2 and see what we learn, what you learn, and what the feedback is.
So Roger, we have a question that's come in. Is the $15,000 per year or over 2 years?
That can be per year, and frankly we're just kind of guesstimating at what the demand may be. Clearly we know what the amount of funds are, and so until we know what the demand is, we don't really know what year two might look like. We could choose to fund a little heavier in year 1 to help folks get started, but clearly that will restrict us in year 2. So essentially work on that for year 1, and we'll keep you informed as we all learn how this works.
So I have a couple other questions that have come in that I anticipated. Can the grant be used to expand existing kindergarten countdown camps, or programs? So for those that participated in the prior webinar with IU Health, if you're in an IU Health community, they talked about, IU Health talked about how for those of you who want to expand to multiple schools or multiple camps, IU Health just simply does not have the volunteers to support multiple camps and multiple schools. What they could anticipate is that, for example, they could identify in your community, if you have run one camp and you want to expand to 2, that maybe one is an IU Health camp and one is a kindergarten readiness funded kindergarten countdown camp. So yes, you can use this money to expand your camps that you're running with IU Health. And we might make that distinction that this particular school camp is supported by IU Health and this other is supported by us. It's not as important from our perspective that it's branded from us, but that all those program elements are there. So I hope I answered that question. So yes, you can use it to expand. And is it with just one school district? Actually, we have a number of communities that have multiple school districts in their county. So it really depends on need. And this is where I would encourage you to look to what does the data say in your local community. You may have, as the case was in LaPorte and in Lafayette, they had such an increase in demand for the camps that it actually became kind of competitive with the schools, that so many schools, and I think maybe even more than one school district wanted them. So it's really about your building that relationship and what makes sense from a need perspective and from the perspective of your ability to deliver.
It is our intent to help you get started in this, or if you've got something going on, to give you a real resource to expand it. So in our ideal, this is a carrot you could take to a school corporation and say, we have the potential of getting this additional funds. Will you provide the elements that are necessary from you to get this done? So it's our hope that you can leverage a little bit of money for a lot of school support as well.
All right, so let's go take just the next slide, and then which gives you sort of the next steps, and then we can answer lots more questions. So in terms of the logistics of the grant process, and actually let me step back. For those of you who don't know, a typical camp, our experience with the camps is that they cost somewhere between $6,000 cash outlay to $18,000 cash outlay to run a quality 4 to 6 week camp, half days in a school with a certified teacher. And what that camp actually what those costs pay for, the most expensive costs typically in a camp are the cost to the teacher, of paying a teacher and maybe a teacher assistant. Then the second highest cost typically is the transportation, if that's included, and then meals. There are a number of other costs that include things like an insurance rider, supplies, the kinds of things to run the camp. But it just depends on what your local school, as Roger said, is able to contribute. So if they are offering the meals and the transportation because it's tied with their summer school, that will reduce your out-of-pocket costs. So you might even not need $15,000.
And I would say, too, you could co-brand this. So if Joe and Bill's grocery store wanted to give you an additional $15,000 to sponsor this and you roll all that together, the kindergarten readiness, there's no restrictions around how you label it and brand it in your community.
Exactly. So we had another question about the match. Does the match need to be cash or will in-kind count?
Cash only?
Yep. I'm getting another question. Let me go through the this slide, and then we'll go through the rest of the questions. We have several detailed questions. So in terms of our process, what we plan to do, last week we had the joint webinar with IU Health that really focused on the kindergarten countdown experience. And just so that those of you who are looking at this as the first time, we have lots and lots of resources for you that we can share in terms of sample contracts for teachers and the instructions on insurance, curriculum or a daily schedule, all kinds of tools that you can use, and many of those grew out of United Way of Central Indiana and then have been modified by the different United Ways across the state. So we've posted that webinar from last week. We intend to use your questions today to clarify the actual 1 to 2 page grant application that we would expect from you. We'll post that next week. If you have technical assistance call needs, we can provide those as a single call or as a joint call if we get lots of questions about the same thing. We anticipate that the deadline for round 1 will be around mid-March, and we're trying to time this to be timed right along the IU Health grant. So we're getting $90,000 from IU Health, and then anticipate that we would use some amount from the Lilly Endowment money, and we want to run those sort of alongside each other because those who've been involved in the IU Health grant know that we've ended up backing into numbers of, we always want to do more camps than what we have resources for, and we may find the same thing with the demand for this kindergarten readiness project. So we want to run the timing of those very much similar, and it fits with the model. If there's a need for a round 2 of funding, either because folks get a late start, they're still working on those relationships, or because they have different ideas, we might do another round 2 in late spring or early summer. And then just so that you all know, we are expected to provide reports to our partners in the fall, right after Labor Day. So your expectations at the local level would be that first you start with what's the need in your community. If you don't know those readiness assessment results, if you don't know what's the nature of the kids entering your local schools, you need to explore that first and identify if you have a willing school. I'll give you the example from several years ago. Tipton Schools was going through a transition in their superintendent's office. So their school district was not as amenable because of the transition in their superintendents and their leadership. So they had to identify what school partner would they use, and they ended up coming to using the local Catholic school because of that transition. So you need to have that school partner identified and see what they have if you're going to look at a camp model especially. You might consider participating in your kindergarten roundup, which are currently being held as early as January to March, and start preparing for your model. And then we would want you to think about seeking your match, submitting your application. Hopefully you would receive the funding so you could start to contract with teachers. Typically the teachers need to be identified by around April or May. In some of the communities, like in Stark County, the summer school runs 1 week after class ends in May. So they have one of the earliest camps, and they run their camp in June. We have other camps that run in July and August. So it just varies, again, depending upon what your local school does. So that your school calendar may drive what your calendar is. And then, again, you implement your program, and we would expect the reports around to us so that we could consolidate all of those common metrics. So now let's take some of the questions. So we have a question from Kosciuszko County that they did a camp in 2013, and they used church volunteers and the high scope curriculum. They're asking if any of the other United Ways have used high scope. I'm not sure. I know that some of our United Way partners do, but I'm not sure if any of them used it in the camp. So if you did, feel free to jump in and type that in the chat box or the question box. If a school system provides food or transportation, even though they may be getting reimbursed, are those dollars considered match dollars? Roger, I'll ask you that.
That's pretty hard cost. I would say probably yes. You know, where you can document an actual cost of that sort, we can take that in consideration, and that feels more like really hard match rather than people trying to, you can't take credit for school classroom space and administrative time and all those usual things that sometimes you want to put into in-kind formulas. But if it's a hard cost that somebody would have to pay for if they didn't contribute it, we can probably figure out a way to deal with that.
But that would have to be approved, let's just
Yeah.
say. So I have another question, just to clarify the IU Health communities versus other communities. So no, you do not have to be in an IU Health community to receive funding from this grant. This is separate from the IU Health grant. So we are getting $90,000 from the IU Health project, and that's only available to those communities with hospitals in their communities, which is about 13 counties in the state currently. This $200,000 over the 2 years is for other communities throughout the state and may be also used in the IU Health communities if those programs are expanding beyond what IU Health funds. I hope I answered that question. Can we use the dollar value from a school? Okay, we got that same question about the transportation. So again, if it's a hard cost, we can talk to you about whether or not that can be included. Will IaUW be providing an assessment or a metric to be used for data collection? So we will provide the Get Ready to Read assessments from Pearson, and we can talk about how we will do that. If we have 20 counties, what we have found to date is that because assessment tools require, there's an application process you have to go to even be approved to purchase the assessment tools, we have found that for the last several years it's easier for us at IaUW just to order that on behalf of all of our grantees and then ship those materials to them. So what I would suggest, and I'm asking Roger this, I would assume that we would be able to continue that for all the projects that would be funded for us.
Sure. Where we can gain advantage, clearly we're talking about collaboration here, so where we can gain advantage for that, we want to do that.
What we haven't identified is if United Ways have other ideas for what might also constitute a kindergarten readiness project. What other type of metric might be used? So if there are two United Ways that say, we really don't, a camp model doesn't fit in our community, or our schools are already running camps, we don't feel like we need to add to that, but we feel we could meet this other need in our community through a summer reading program or a parent engagement program. So for example, I'm just dreaming up what you all might bring to us, but for example, if a United Way says we really want to engage our kindergarten teachers and we want to pay our kindergarten teachers to make a home visit to every single kindergartner in their school or in their class, and that's what our project will do, and here's what we will measure. We haven't identified what those other measurements would be, and that's why this is really hard for us, because this is more prescribed, that we want you to do a small project. Kindergarten Countdown Camp is actually a pretty big project, but it's contained, and we need those common metrics. So if you're thinking about something other than a camp model, please bring those to us. Let's have a conversation and talk about what common metric someone else might be willing to use. Is any county eligible, or is it only, I think we've answered that. Great. Will we be assessed a fee for the Get Ready to Read? We would pay that out of the grant for the Get Ready to Read assessment tools. And it costs about, I'm forgetting right off the top, I think for the first year it's about $150 per camp, and then in multiple, or if you have multiple camps, it's not $150 per camp, because there's the initial materials and then there are sheets for individual students, but we can give you those costs. We would pay for that out of the grant. Let's see. What was the average class size for a kindergarten camp, and was it typically one class or one school? Good question. So typically we try to register 20 children for a camp, but in some communities what ended up happening is they would have 18 students, maybe even 15 students in some of our most rural. We recommend not going forward with a camp if you don't have closer to 20, because if you get down to the 12, it's just not cost effective. So typically about 20. We do have some classes that have 30, but they definitely have two paid teachers in a room of 30 students. So hopefully that answers that question. And you can have multiple classes in one school. So in a number of our communities, we have a school that may have 2 or 3 20 student classes. I'm looking at my other questions. I think I have hit all the questions. So I do have another question about the assessment tool itself. Does provision of the assessment tool include analysis of the results? Let me explain how that has worked over the last several years. Because of our relationship with United Way of Central Indiana and their incredible leadership in this area, Heather Gerton, who has been the mom to many of these camps, has provided an online data reporting tool that you actually upload your pretest scores for your children and your post-test, and she sends me a spreadsheet and we compile all the results together. So the assessment is really rudimentary. I don't want to overstate the fact that Get Ready to Read is not the best kind of assessment, but it's the best that we've identified for this purpose, in that we can cheaply and quickly administer it to lots of different locations and at the same time and have a common metric. But we would help you with that analysis. What you would do is you would provide us the scores, and then we would provide those the analysis and the, for example, the graphics that you saw. Let's see. Lori's sharing that she worked to register 25, but what she found out is that she always would end up with closer to 20. So she would try to get 25 sets of parents committing their children, and then 20 would actually show up. We're getting asked, why are we not using iStar KR? Good question. That may be something that we will change over the next couple years. We understand that some school districts were a little resistant to using iStar KR. So if a school was pushing back, we did not want to require that. And again, we just had to identify a common metric that everybody could use. And because Get Ready to Read is independent, we could apply it at the first 2 days and the last 2 days of camp and get that done. iStar KR may be something that we would want to explore in the near future. So I'm getting more questions. Is Get Ready to Read a necessity for this grant? Our program uses an assessment piece we've created with the help of our community and our kindergarten and pre-K teachers. I would say that for this grant, we are requiring that. And again, as I've mentioned, a number of our other communities use other assessment tools in addition to the Get Ready to Read. This allows us to have a common metric among all of the United Ways that participate in this. And I don't know, Roger, if you want to speak to that at all.
You know, part of what we are looking for here is working with a prescribed program that delivers clear identified outcomes from common sources. And so clearly that's where we're leaning. I think we'll listen to you make a case, but I can't guarantee that we will come off of that.
Okay. I have one more question related to those in IU Health communities. So if I'm in an IU Health community, so Peggy, Those who are just doing the one camp with IU Health will be in touch with you about the process on that. We should have that MOU and grant agreements out hopefully within the next month. So if you're one of those communities, just assume that you're going to be able to move forward. If, however, you're in one of those communities and you want to expand to another school or another classroom with more children, you would need to apply through your United Way or United Fund for this grant as well. So you would essentially have two grants running at the same time, the IU Health grant and the KRP grant. And I can follow up with you, or you can follow up with me directly offline about that. I'm not seeing any other questions. Any other questions? Let me look through if I see any other questions on anyone online. No other questions? Is Kindergarten Countdown name owned by IU Health? No, actually the Kindergarten Countdown name was branded by United Way of Central Indiana, and they have freely offered that to be used by all of the projects in Indiana. If you are welcome to use that name, but if you use that name, you need to follow the very prescribed model. You are also open to brand it some other name. So for example, I know Cass County is very proud of Begindergarten in their community. So you could identify a different name, or as Roger said, if your local grocery store or somebody else has a catchy name that they want to help co-brand, you're welcome to do that. IU Health does, however, have a lot of stake in the Kindergarten Countdown, so just as an example, they promote that internally. It is considered their signature volunteer project, so if you are near or in an IU Health community, you may see some spillover effects from that. Any other questions? I think going once, I'm not seeing anyone typing. Okay. Well, if you do have any questions, we encourage you to give us a call or email. I know that I'm sometimes hard to reach right now just because of the legislative session. As an aside, I will offer you that for the pre-K bill before the legislature, IU Health lobbyists came in and testified and talked about the results that they've seen in Kindergarten Countdown and how important it is to have early childhood experiences across the state. So it's just one more example of how that partnership goes beyond just this particular mini grant. So I'm not seeing any other questions. All right, so we will follow up with you.
I would just chime in.
Go ahead.
I would just chime in quickly that I have heard nothing but great comments, and people love the Kindergarten Countdown that we've done. That's part of the reason we included this opportunity in this grant, to give more of you a chance to engage your community that way. And we hope you see this as a really great opportunity to get something started.
Great. So, and if you do have one of those other ideas, we didn't see in the chat box or in the question box anybody raising a different model. If you have a great idea for a different model that's contained and meets those criteria and has a common metric, please let us know, because we invited that as a part of this process. The CAMP model is something certainly that has been warmly received and is easy to replicate. So we're anxious to expand that beyond the hundreds of kids we've already served over the last couple of years. So I'm not seeing anything else. We will post all of this information. Feel free to watch the last webinar if you didn't participate in that, and we will be in touch, as we know there are lots of IaUW activities coming up in the next several weeks and months. So thank you all.